Great. Welcome to the March 3rd meeting of the Citizen Oversight Board. Glad to have everyone here today. We are joined by our special guest, Sheriff Elias Diggins. We're going to get to the sheriff in just a second once we get through some board business. Let's begin. Let me get back to my agenda. I just lost it. So the first thing is if folks have had a chance to review the minutes from our previous meeting, and if there are no changes, if we may approve them.
So moved.
Great.
Second.
Great. All in favor? Aye.
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 Any opposed? Okay, the motion passes. Great. A couple of announcements. So if you recall that the board was working on some changes to our ordinance in order to update a little bit about how board members are selected for the board itself. The pay for board members, shifting that from a monthly stipend to a meeting-based stipend. So the more meetings, the more payment. And a couple of other small changes. That was signed by the mayor this week. So the ordinance has passed and those changes, I believe, become effective immediately. So that's great news. And board members can expect a slight uptick in the payment for your contribution to the city. So appreciate that. And then we probably need to get together and talk about how we intend to support recruiting processes now that this has passed. So excited about that. And congratulations to board members in moving that forward. As a reminder to the community and board members, we still have one board vacancy. And so now that we have a new process, excited to fill that. The last thing is that our annual report will be issued March 15th. And our March 17th meeting will be a presentation of that annual report, and we'll use that as time to respond to public comments as well. So community members who wish to ask questions about that are welcome to at that time, and that should be publicly available in advance of that meeting. Just a thanks to all the board members, and in particular Nick Weber, who helped to facilitate the draft getting complete, and of course Daniel for the bulk of the writing on that, and helping to facilitate all of the cats on this call getting reviews completed. We'll spend a little time in executive session formalizing some of the language and getting agreement on the recommendations, just to ensure that everybody's had a chance to talk about them together before we publish them. So if you haven't had a chance to look at it, it's a good opportunity to do it quick before we talk about it in an hour. So so get that done if you wouldn't mind. I think that's all the board. Oh, one more item is as part of our strategic plan, we have a deliverable around developing our community engagement plan, and that is intended to be complete by Q2 of this year. Larry has taken a really strong leadership role on that, and we've had a couple of meetings on the topic. And so before we get to the sheriff, Larry, are you in a place where you can sort of walk through that plan with the board?
Morning, everyone. Yeah, do you want me to do that now, Julia?
Sure, I think that's great.
Great. Are we sharing anything?
Daniel, if you want to just pull up the doc,
Sure.
Maybe that's the easiest way.
Cool. Good morning, everyone. As Julia mentioned, we've have been able to meet twice around the deliverable of community engagement, and really just to get a framework as to how to move forward, begin to create some of that infrastructure for recurring meetings, and to be able to capture ideas from the rest of the board. So we do have this document that we would like to share and show everyone where we're at in the process. This is a living document. Nothing here is set in stone. We have some suggestions, but we're also looking for ideas, input in regards to some of the stakeholders that are identified here. So we've got our goal, very straightforward. Questions to answer are there particular communities we want to target. We spent some time talking about that, and there were some that came to mind either because of existing or past activities that have happened there. But again, all of that is very open to input. We talked about events and how many we want to commit to. Also keeping in mind the capacity of the board. So right now we were thinking that maybe we could start off by asking if folks like the idea of board members committing to one event a year. That would allow us, being that there's 9 of us, to be able to commit to at least one event per month. And we were thinking that maybe there's 3 months where there's not a whole lot happening because of weather. So at 9 months out of the year, we would be able to commit to some type of an event. And then we tossed out different ideas of where we thought that the COB could have a presence in connecting to the community. And a lot of these are already existing events that we threw out. We attended the Servicios de la Raza event last year, so we put that back on here. And then there's just some of the other big events that happen in Civic Center and around town. And then we brainstormed partnerships and some of the organizations that we've partnered in the past or that we would want to partner with more to help get the word out about COB and create some more vehicles for folks to find out and engage with the COB. Yeah, so then the last thing we talked about were budget items of what we might need to help us be able to do this. So we talked about we have the city badges, but maybe having those be on lanyards so that when we are at an event representing the COB, we have like an official presence. We talked about maybe some branded clothing like shirts or hoodies or something, pamphlets and brochures, just to be able to disseminate basic information. And then we also talked about maybe printing the annual report that we could take along with us to different events or when engaging with different folks. We talked about some different stakeholders. I might have missed it up above, but we had talked about like engaging with city council. We briefly tossed out the idea of mayoral candidates, but I think quickly got overwhelmed given how many there are. So yesterday we talked a little bit more about maybe attending some of the existing forums, which I'm going to plan to attend one here in the next few weeks. And yeah, so I think that's as far as we've gotten. So happy to answer any questions, and please comments and input.
Can that be Larry, that looks great. Can that be circulated then up to the board by Daniel, and then maybe we have some time to digest it and provide some comments, obviously, but boy, preliminarily, it looks really good.
I'll send that out this afternoon.
Thank you.
Good.
So I think a couple of areas in particular, maybe to focus on are, a commitment to 9 events a year, because it would, require time of each of us. The specific districts, I can't remember if we did council districts or police districts on our list, but I'm just not remembering the words we used on that. So look at that. One thing we talked about too is, would we want to engage, specific RNOs or specific organizations within those districts? So, not the whole district, but a select set or more honed, list of organizations or communities. So take a look at that, make sure that, you like what's there, or if we're missing anybody, add them in. And then I think that was kind of the big things. So. Okay, anything else, Larry, you want to highlight on that?
Just that the mayoral forum we talked about attending is there's back-to-back 22nd and 23rd of March. I believe Daniel has sent out some information about them earlier in the week. So if others are interested, the more the merrier, but I'm planning to attend the one on the 23rd.
Great, thanks for the reminder on that. So we did have in our strategic plan some amount of engagement with mayoral candidates. I think in light of the number of candidates, it proves to be really hard to execute a plan without getting ourselves in trouble for not meeting with everybody. And there are some forums DJP is hosting. And so that's what Larry is referring to if you haven't read your email. And so if you'd like to attend, we'll work with DJP to see if we can't get a specific question in there. I know policing is a hot topic for most of the candidates, and so it will be interesting for us to engage. My hope, ballots, I think, get mailed the 13th. So we'll get through the first round of voting, and then my hope is to engage with a smaller set of candidates if that works for folks. I don't know if there are enough hours in the day to do all those meetings. So let me know if you disagree. Happy to take feedback on that, but that's the going in approach.
So we'll shortly be down to 2 candidates, and then that's far more manageable.
Yeah, exactly. Except based on the polling I saw last night, it's a dead heat between everyone. So it should be interesting.
At 4% and 5%.
Yeah.
I saw it too, yeah.
It's like everyone's at 5% plus or minus 5% margin of error.
Right.
I'm actually at 5% as well.
No, you're in the lead, Terrence. You got 5.3.
The real goal is to get above the margin of error, I think, for any candidate.
Yeah.
So anyway, best of luck to all the folks running for office. Thank you for your commitment to our city. So I think that's all the board business. Let me just confirm on my agenda. Daniel, am I missing anything? I think we're good. Okay, so with that, let's go over to Sheriff Diggins. Sheriff, thank you for joining us today. I know we sent you a bunch of questions, some of which are pretty in the weeds. So if you have anything you'd like to open with before you get into the nitty-gritty details on those questions, that'd be great. And if you wouldn't mind, sort of reading the question before you answer it, that would also be fantastic.
Sure. Thank you, Madam Chair. And folks, it's my pleasure to be here with you today. I continue to say it's my privilege to serve as the sheriff. Before I begin, let me give some recognition to the men and women of the Denver Sheriff's Department who every day show up to do a fantastic job of being community servants and serving the citizens of the city and county of Denver. I also want to let Larry know that's a great looking community engagement list. Many of those events, in fact, all of them are places where you will see members of the Denver Sheriff's Department. And so we look forward to seeing you all there as well. I'll go right into the questions. We're starting first with the Denver Health contract for the public. That is a document which is available on the clerk and recorder's website. And the specific sections related to the Denver Sheriff's Department are in sections A6 on page 40, section B3, which is on page 73, and section C7, which is on page 102. The first question is, now that the city's contract with Denver Health for 2023 is finalized in public, can you speak to how you believe the new changes allow for increased oversight of contracted health services? Well, I'm also going to be talking in just a moment about our new administrator position, but specifically in B3 and the acute and chronic health care at Denver County Jail and Downtown Detention Center. On page 73, it talks about the authority of the sheriff. And it states the sheriff or designee reserves the right to deny access inside of any sheriff facility to authority employees or contractors for violations of any DSD rules or code of conduct or background check requirements. We adjusted the language to say that I, as the sheriff, or any future leader of this organization, has the specific right to deny access to folks when we believe there is cause and justification to do so, based either on a risk that they present to the folks that we have in our custody, or perhaps a security risk, or to our staff as well. We believe that this language is strong enough to ensure that when that happens and these incidents are brought to my attention, that we can remove that person without there being any question about who has the right to make that decision, which will be myself. So I'll pause there to ask if there are any questions before I move to the next. Okay. Next question. What do you anticipate will be the impact of the new administrator position? That language is on page 40, which is a portion of A6, medical services for arrestees, pretrial detainees, and inmates of Denver Health and Hospital Authority. And it says the sheriff may designate an administrator to serve as the official city representative for this appendix. Communication between the city and the authority shall be directed through the city administrator or such other representative as the sheriff shall designate. The city administrator will serve as administrator for the services the city is paying for through the authority, and the sheriff will also be able to ensure that that person has a Denver Health Authority employee that they can promptly contact to address and work to satisfactorily resolve any issue or concern. Many years ago, we had a position that existed in our organization. And in fact, back then I was a major in the Sheriff's Department, and Director Lovinger, who was the head of our organization back then, worked with the city attorney's office to bring on board a person who not only was an attorney, but also had a medical background to work specifically for oversight related to the Denver Health contract. Well, I can tell you that through that process, we were able to ensure that all the services that were a part of the contract, as well as the billing that happened relative to that, were done in a way that sometimes the Denver Health and Hospital Authority would return back to the city funds because the accountability was tight. This year, Director Saldalte, the Chief Financial Officer for the Department of Safety, Laura Wachter, and I sat down and talked about how could we return to a system where we could have someone who was sort of a watchdog to begin to do the same thing that we did many years ago. This is the position that we are now creating, and we'll begin to move forward with putting that position in place here in the next couple of months. We anticipate the impact of that will be some additional oversight for Denver Health based on that person's background to ensure that the services that were being provided are those that are expected by our department, by the rest of the city, by the folks that are in our custody, and by the community as well. I'll pause to answer any questions that you all may have.
So Sheriff, I've got a question sort of
Yes,
related to those two. Thank you. And then I guess, because this is all related to contractor accountability in the next sections too, I think it's all pretty intertwined. So why don't I wait until you get through all 5 of those? That'd be fine.
Okay, sounds good.
Yeah. Yeah.
All right, I'll move to the next section, which is contractor accountability. You all stated in our February 3rd meeting with Executive Director of Safety Saldalte, he stated that the department was concerned by what appeared to be a lack of attention from medical staff and immediately removed the charge nurses' access to the jail. Question 3, has the DSD removed access for medical staff like this before? The answer is yes, we have. If so, how many times in the last 5 years have medical staff been denied access to DSD facilities? And speaking to our Director of Security, who has been on board for 4 years, as well as the Denver Health and Hospital Health Services Administrator, who works directly with our department, in the past 5 years, we have denied that access for approximately 4 people. In the past couple of years, that has been 1 person in 2022 and 2 in 2023. So I'll pause and ask, are there any questions relative to that?
Can you say that number again?
Sure. In the past 5 years, we can recall that there have been 4 people. And one was last year that you all aware of, and then there have been 2 this year thus far.
And then just for comparison, how many medical staff are typically serving in the facilities in an annual basis?
There are literally dozens of
Hundreds.
medical staff on an annual basis. We have a very large contingent of Denver Health personnel. We process about 22,000 people through our system every year, and every single one of those folks has medical attention that's given to them by the Denver Health staff. So they have a very large presence inside of our organization. So that represents a very small group of folks for Denver Health. And let me also just say, the folks that we work with in Denver Health, the health services administrator, the nurse manager, their chief medical officer, Dr. Crum, Carol Rogers, and Carmen Casale are folks that we've worked with for many years. A couple of them have been here over 20 years. They do a fantastic job in leading that service and providing quality care to the folks there in our custody. So it's few and far between when we have to pull that lever and deny someone access into our gym.
So I guess a follow-up question to that is so it sounds like most of the people you work with are really great. In very rare circumstances, they're not, which is, pretty typical of any employment situation. In those circumstances where folks were removed, were the conditions fairly similar across, or was it sort of, a variety of reasons? And you don't, have to get into the specific, individuals, but more of like, is there, in the cases where people were removed, is there a pretty consistent behavior which is unacceptable, or is it more a reaction to specific behavior?
It's a variety of reasons for specific behavior. And again, those are personnel actions, but it's not all of the same behavior.
Thanks.
I'll move on to question 4. What is the threshold or process before the DSD revokes access? Does it require sheriff sign off, or can other leaders make the decision? The ultimate decision is given to the sheriff, or it's up to the sheriff to remove that access, to revoke that access. The threshold of process is generally a complaint will be filed, or some incident happens that requires us to review what happened preliminarily related to something that happened in one of our facilities. And based upon that information and in consultation with the leaders who are inside of our agency, we'll make a decision about whether or not to deny that person's access. And I'll pause for any questions. Okay, the last question in that series is there a way for the access to be reinstated after it has been revoked? Have you ever reinstated contractor access once it has been revoked? The answer is yes, there is a way for access to be reinstated, and we have reinstated access after it has been revoked. In fact, I've done that once this year. That's the end of that series. Stefan, I know you said you had a question that you wanted to ask relative to this.
Yes, thank you, Sheriff. So I think the board's concern, as we have expressed before to Executive Director Saldate, as well as yourself, surround what happened obviously with Mr. Taylor. And the concern is, and it's great that you have the authority to remove somebody who does not comply with Sheriff's Department rules and the like. I think our frustration about this entire situation is that perhaps you folks, again, didn't get the information to fully and fairly investigate the cause of Mr. Taylor's death. And when we tried to get that information from Denver Health and inquired about it, frankly, they said that they weren't going to provide it, that any results of their internal investigation, I guess, were not going to be publicized, and that you all had received it. How can we, I guess, so laying that as a foundation, how can you get full accountability for something that may have gone horribly wrong? and resulted in the death of a particular inmate, if we can't get the results, if you can't get the results of an internal investigation as to whether something was improperly done in providing medical services. I mean, Armando had said, listen, he doesn't have that expertise. I don't have that expertise. I know you don't have that expertise. So we rely on those that do have expertise to know if something went wrong with respect to the provision of medical services. How do you get that information unless you can get reports of that internal investigation? And being a lawyer, I'm very mindful of the liability issues, and I get all that. But still, for purposes of transparency and accountability, we think this issue has to be addressed in some way.
Yeah, thank you, Stephan, for that question. First, let me begin by again stating the Sheriff's Department sends our continual heartfelt condolences to the family of Mr. Taylor. I agree with Director Saldalte. It is something that we will continue to have to work with Denver Health on. They have new leadership, and there are some additional conversations that are occurring currently relative to how do we improve that relationship and the transparency through Denver Health, because there is ongoing litigation. There isn't much that we can say, but what I can tell you is that the public can be assured that if an incident happens in our facilities, and we believe that any person, including Denver Health personnel, pose a risk to the safety, security, or perhaps healthcare to the folks that are in our custody, we will do everything within our authority, including removing their access immediately, as was done in the Taylor matter, to ensure that we are protecting the people that are in our custody.
I mean, I guess what I'm hearing you say in light of the potential legal issues involved is that you immediately remove this nurse who may or may not have engaged in misconduct to deal with that issue, but the rest of it will have to play out through perhaps litigation, which you're not in a position to comment on at this point, because there is pending litigation in terms of determining the fault, if any fault occurred here, and then who's going to bear ultimate responsibility. I mean, is that accurate?
That is accurate. Once I became aware of the situation,
yeah,
I personally ordered the removal of the access, the revoking of the access for that person, and contacted Director Saldalte, and he agreed with that decision as well.
Yeah, I think what we're concerned about is sort of lessons learned too. Look, this was a tragedy. I think we all agree. But it's also, until you can get the facts through an internal investigation or otherwise about what went wrong here, it's critical that something like this doesn't happen again. And that's something that, you know, the Sheriff's Department would want to know based on the results of an internal investigation, something OIM would want to know, something that we would want to know. So that's the frustration and the delay here in not getting that type of information so that we can get to the root cause of this and engage in appropriate corrective action in the future.
We agree with you, Stephan.
Okay. Thank you, Sheriff.
Just a little bit of a walk back from that. So, you know, assuming based on the data you've shared, right, it's really rare for, you know, some egregious event to happen with medical staff such that, you know, we need to terminate their access. What is sort of is more common. You know, I think there are somewhere in the hundreds of complaints a month for Denver Health or, you know, healthcare related complaints, which presumably are related to the care that Denver Health provides. And so moving away from the sort of like, you know, outrage machine of somebody dying in custody, there is also a condition where there are a lot of complaints you know, every month about the care given. And so I'm interested in your thoughts on, you know, do you feel like you've got appropriate accountability from your vendor in addressing those complaints? Do you feel like you've got a process for, you know, gaining transparency or doing, you know, analysis of, you know, sort of root causes, right? If I get 150 complaints a month and 100 of them are related to, you know, I can't get my glasses or, you know, some single type thing, you know, do you have information that allows you to hold the vendor accountable to deliver changes that improves that? Or is that sort of a black box, which is my perception that, complaints against you go towards you and complaints against you go towards them. And, ne'er the two shall meet. So just, moving away from a death in custody case, I'm more interested in the general oversight and relationship and accountability that you feel like you have to hold this vendor accountable to make changes that improve, against complaints.
Thank you for that question, Madam Chair. I do believe that we have the mechanisms in place to hold them accountable. Ultimately, the buck stops with me, and that includes the service that Denver Health provides. Nationally, I can tell you, I've been to jails from border to border and coast to coast. One of the most complex things that jails have to provide is medical care. And in relation to other medical providers, I think Denver Health and Jail Services does a very good job. I think we have the Utilization Management Committee, whereby they provide statistics so we can gauge the grievances as a barometer for how things are occurring, is one that I would compare to other jails that are running well. And I think the next question points directly to that when we're going to be talking about accreditation as well. That national body agrees with that, and we stay continuously accredited as an agency. So I would say that we do. I have no problem. The leaders in our agency have no problem in getting information directly from Denver Health when it comes to the day-to-day management of things. And again, I'll say we process 22,000 people through our system. 22,000. A lot of those people have some very brittle health conditions, and they have them addressed every single day by the Denver Health team. And we want everyone to come in and hopefully return back to the community better than how they came to us. Oftentimes, that is because they have received quality care while they've been in our custody.
So when those complaints come in, do you have the ability to see them, parse through them, analyze them, and come back to Denver Health on them?
If there is a need for me to review those complaints, absolutely. I can go up and review any complaint, any file at any time. And some of our other executive leaders can do the same thing. And there may be times when that occurs. We'll all call upstairs. I'll hear about something that happens, and I'll take the time to say, can you bring me this person's file? And no less than 30 minutes after I call for the file, I'll have it in my office and I'm able to review it and go through it and look at the grievances or see something else that has occurred. There are times when I get calls from members of the community directly because I'm a part of this community and folks know that they can reach out to me. I'll call upstairs and get that person's file and look through it and tell them what's going on as far as I can with the HIPAA restrictions that we have. But there are times when that happens and I have no concern whatsoever with the ability to be able to do it.
Thanks. And then, sort of a global question, is there a habit or a procedure that your team and their team uses to say, on a monthly basis, here are the complaints that we're getting, here's the remediation, or here's the systems issues we need to deal with. Let's make a joint, plan. Let's have some metrics that say we had X number of Y things, and in the future, we're going to have, X minus 10, and really reduce events.
Yes, there is. And in fact, we have members of our department, uniformed staff members who are assigned to the medical unit, and they're a part of the Utilization Management Committee with Denver Health. We also have a captain who oversees the services at Denver Health that meets with their staff as well. So the answer to that is yes, ma'am.
Thank you.
If there are no other questions relative to this section, I'll move on to the next, which is NCC accreditation. The healthcare services at DSD facilities are accredited by the National Commission on Correctional Healthcare. Director Saldalte has shared with the board that the Downtown Detention Center facility received continuing accreditation with verification in January 2022. Our understanding is that the result is a conditional accreditation that is dependent upon verification of certain changes at a future date. Has that verification taken place? And if so, what was the outcome? That verification has taken place. And just for the board's information, I'm very familiar with accreditation processes. I'm the former chair of accreditation for the American Correctional Association and have been involved with our accreditation processes, both through the American Correctional Association, the Commission on Accreditation through law enforcement agencies, and have worked with Denver Health on their accreditation through the NCCHC. So when you have a facility that does not at the time have all the documentation or the proofs relative to a certain standard, and those are called expected practices as well, they can submit those at a later time. That's what the NCC asked for us to do. That was done by Denver Health. And those two proofs that were submitted were relative to officer rounds for suicidal patients. And also the second was for medical kites being answered within 24 hours. Once those were submitted to NCCHC, they did review those proofs and granted us full accreditation. So I'll pause and answer any questions you all may have relative to that. Okay, seeing none. The next question, the NCCHC provides two additional types of accreditation: mental health services and opioid treatment programs. Have you sought or do you plan to seek those additional accreditations? We do plan to seek them. There are conversations that are ongoing inside of our agency about moving forward for those accreditations. We do have a very robust mental health services team. I'm very proud of the work that we're doing, and also very proud of the opioid treatment programs that we have inside of the Denver Sheriff's Department. So we believe that we will be able to meet those expected practices, those standards that are set by NCCHC. We'll be happy to report out to you all when we do seek them and hopefully eventually become accredited. So I'll pause and ask, are there any questions relative to that question? Okay, seeing none. The last section is related to medicated assisted therapy pause. Last year, you set aside a housing pause specifically for inmates participating in your MAT program. Have you seen the results you hope for in terms of being able to more easily provide the relevant care and programming? Do you have any thoughts on expanding that program? Very happy to report. Let me pull up data and statistics that we've received on this, that we have done great work in this area. For 2021 and 2022, and I'm not mentioning 2020 because it was an anomaly with COVID and our numbers were a lot lower for the people that were coming into custody. But for 2021, there were 3,478 people that claimed opioid use disorder at booking. In 2022, that number was 3,500 people. For successfully completing our MAT program in 2021, before we created the MAT unit, there were 269 people that were released from custody without being discharged from the program, 269. In 2022, that number went up to 578. So there was a marked increase in the number of people that were completing that program while they were in our custody. And just for you all's information, there are 5 medications that we administer: buprenorphine, methadone, naltrexone, Suboxone, and Vivitrol. The last part of that question is, do you have any thoughts on expanding the program? We would love to expand those programs. We know that there is a significant need, especially with the opioid crisis that we're in our country, and many of the folks that come into our custody. As you heard, those statistics could come in, be stabilized on those medications, and hopefully continue into treatment as they go back to the community. I think the barriers to that right now are the fact that our staffing is extremely low right now, as has been talked about with this board. And once we're up to closer to our authorized strength, we'll be able to do more things inside of our department to provide more programming, to provide perhaps some additional pods related to MAT. I'm a huge believer in these programs and know that the Denver Sheriff's Department is a national leader in this area. And as we look at this from a public health lens, from a broader perspective, even outside of the Denver Sheriff's Department, being able to help folks to get stabilized on those medications is not only going to help us to reduce recidivism, but it's going to help people when they come back to the community. So I'll pause and ask if there are any questions relative to this.
Can you just remind folks how those units are staffed? Is it a combination of health professionals and deputies?
It absolutely is. They work side by side. We specifically choose folks, deputies, and other personnel who understand the why behind the program. And so they get to know the folks, they want to help them. And the medical staff does the same thing. The programming in there is very robust. So we look forward to having some increased results as we move forward with those programs.
Thank you.
I don't see any other questions. Yes, Stefan.
Just wanted to follow up on an area that Julia hit on earlier on back to Denver Health and accountability. And Sheriff, appreciate that the answers that you gave in response to her questions about going beyond the tragedy of Mr. Taylor's death and, you know, just general medical service issues that you deal with and how those are triaged and addressed. I don't know if you're in a position to answer this, but were there over the course of the past couple of years, and you say that, you know, you have somebody who had, you know, somebody was a captain that oversees the services for Denver Health. Was there a particular area or areas that as a result of complaints that were received about medical services that the sheriff's department, you know, took an active approach to make changes in the processes and the procedures that were being provided by Denver Health in a particular way? Did you see a pattern in practice there that has been corrected over the past couple of years?
I wouldn't say that there is a pattern in practice of negligence at all, Stefan. I would say it's the opposite. When we bring issues to the attention of Denver Health, they're quick to ensure that they pivot and adjust those things. With the folks that we have on board, with their health services administrator, their nurse manager, and their chief medical officer, they work side by side with our staff as they have for many years to address these issues. I don't think there's any pattern of practice that we could point to. What I can tell you is that it's something that we take very seriously. We know how important it is, not just to the community at large, but also to the folks that are in our custody. We want folks to leave our jail better than how they came here. We want them to receive quality care while they're in our custody. So the contract and the relationship that we have with Denver Health is very important. It's probably out of all the contracts that we have. We have food service contracts, we have technology contracts. Out of all of them, it's probably the most important one because it deals with lives. It deals with the health care of folks who are community members. And so we want to ensure that it stays on par. I'm confident that it's going to continue that way. We've had a number of conversations already with the new CEO of Denver Health, Donna Land, who actually came to the jail to do a tour. She and I, along with her COO, Chris Gaw, did a tour when Donna first got here. I was very impressed by that. That's how important that relationship is, not just to us, but I believe also to Donna Land and the administration as well.
Thanks, Sheriff.
Other board member questions?
Well, again, thank you all for the questions. I do have one update that I wanted to give you all. We do have some very exciting news. I didn't get a question about the tablet, but I have great news to share. In fact, we are rolling them out on March 17th. And in fact, the carts that hold the tablets are here. They're on site. They're being installed. We're now going through a communications process internally with our staff, as well as with the folks that we have in our custody. And we're also preparing an outward-facing communication strategy for the public and for the media as well. So in the next couple of weeks, those will be deployed. So it's been a very long process. We appreciate the Citizens Oversight Board's interest and support of that. We're confident that this is going to be a great tool for the folks that are in our custody and our staff as we help folks to stay connected to their family members, to be able to use those educational tools and other things, and just very excited that we were able to put this into place.
Congratulations on that. I know it's something the board's been really supportive of. So certainly we're eager to hear more from you as you learn about how that's going and, you know, how are people using it? You know, I know in particular with staffing shortages, you know, sort of the educational opportunities have been diminished. So really eager to see what kind of capacity building you're able to do through those tools and really eager to learn more about that.
Thank you, Madam Chair. Thank you, board. I appreciate all of you. It was great seeing all of you. I would just like to end with saying, I think this is the first time that I've ever been in a meeting that Terrence Carroll didn't say anything. So I'm not sure. Are you okay, Terrence? Is everything all right?
You know, I was just giving you enough rope to deal with your own self.
All right. Well, thank you. I appreciate that.
He's trying to get out of the margin for error in his mayoral run. So he's got a tight lip.
I hope to get your endorsement after the barbecue kerfuffle a few years ago.
You already know the answer to that, Terrence. All right. Thank you all.
Thank you. Appreciate it. All right. Monitor's office, Monitor Castle, do you have anything you'd like to cover in the public realm?
Not at this time. Thank you.
Okay, great. Do you have any ongoing or open matters that you'd like to discuss in an executive session?
Not at this time. Thank you.
Okay, great. Board members, I'd like for us to adjourn into an executive session in order to finalize our recommendations in our annual report. And so if I may have a motion to do that. Great. All in favor?
Aye.
Any opposed? Great. We'll see you over there. Thanks.